Hey everyone, so I'm totally filming on the floor right now, but I needed the best light in my place. I know that I filmed a lot on this whole experience about buying a condo, but today I actually want to talk about my dental implant experience and the do's and don'ts of getting dental implants. I finally finished my teeth. I'm going to zoom in on them really quick so you guys can see. They're all done. They're all there. Feels really good. So let's talk a little bit about dental implants. I may have to break this up into two videos because I have a lot to say about this. And hey you guys, did you miss little Nunu? She's back! Ah! Anyways, dental implants surgery was not as bad as I thought it was going to be. I think a lot of people have this fear about getting something drilled into their bone, and it did seem really scary to me, but I do have a few tips when it comes to getting the surgery, and the first tip would be definitely go to sleep. So I actually stayed up for part of it and then I went to sleep for part of it. So I can attest to tell you that if you can afford it and it's in your budget, definitely go to sleep. I don't consider myself really squeamish at all, but like that whole experience of staying up, I don't wish on anyone, and I say to definitely not do it because it was not cool at all. When I first went in for my consultation, we talked a little bit about different steps and how my doctor actually goes ahead and does surgeries typically for dental implants. So as you guys know, I had braces, and so they had to make enough space for me to fit the dental implant in, and so my root of my tooth was kind of bent like this, and so I actually had to have my braces on an additional like 3 or 4 months just so they could get the root straight. So as soon as they did, they had to make sure there was enough space for that screw basically to fit. And after they did that, then they knew that I could get the dental implants. So the first thing we actually did was take an x-ray so he could make sure I had enough space. And then he talked a lot about the steps of the surgery. The first thing he told me was that he does bone, pretty much puts bone in pretty much for everyone. Bone, I guess putting the cadaver bone or whatever kind of bone it is. I'm not the expert, but I do know that they add bone in, and I had heard a lot about that, and some oral surgeons don't or do. I have no say on that because I'm not an oral surgeon, but my doctor, Dr. Walker, said that he puts bone in pretty much for everyone, so I had to go ahead and do that. And so he does it either in 1 stage or 2 stages. The first stage would be that he puts the bone in and puts the actual like screw in without the abutment, and the abutment is the thing that like sticks out from your implant when you don't have the tooth on. So it actually is underneath my tooth, and it's what holds in the fake tooth like onto my gum. I actually opted not to have that on my front tooth because I was afraid that I was gonna bite into something and the screw would pop out, and if the screw pops out, your surgery is like no good. So for me, it being in the front, I was afraid I was gonna chew on it or something, and so I said leave the abutment out. So I wish, tip number 2, that I would have just put the abutment on, because that would have meant that I had another stage of surgery. So what happens is they put the abutment on, if they put it in on 1 stage and put the bone and put the actual like implant screw in with the abutment sticking out of your gum, then you only have to go in to test the implant, and all they do basically is screw a tooth on it and kind of wiggle it around and make sure basically that your screw will hold on a tooth and that you can actually chew into like really hard surfaces and stuff, and that your tooth and the screw aren't going to break. So that would have been a lot easier, because with me leaving the abutment out, he was going to have to cut my gum, which he did, and I was awake, and put the abutment on and then test the tooth with it. So I highly would suggest just going to sleep if you can and doing a 1-stage surgery if it's possible. I know a lot of people do 2 stages. Do 1 if you can, or if you have to do 2, please go to sleep. I'd like to keep these videos short and sweet for you all, so I'm gonna continue on with video number 2 in a bit. But I wanted to remind you guys that I actually just reactivated my Instagram. It's Mariah Navit _, so MARIAHNAVIT _. And like this video if you like this video, of course, and comment below if you guys have any questions. I'm happy to answer them. I'm gonna do an entire video on answering questions for you guys, so stay tuned, and thanks so much for being amazing YouTubers and leaving me amazing questions, likes, comments, and everything. So talk to you guys soon. Bye.